We've just looked at two ways of keeping total healthcare costs under control. One is to reduce the prices we pay for healthcare services. The second is to stop using unnecessary tests and treatment. Now we're going to look at two additional ways of keeping the total healthcare costs under control. One is to keep the chronically ill healthy so that they don't need a lot of healthcare services. And the last is to use digital medicine and telemedicine more wisely to make healthcare much more productive. Now, when I say prevention to most people, they think, oh, vaccines, cancer screening tests like mammograms or colonoscopies or pap smears. But I'm not talking about prevention with people who are healthy. I'm talking about tertiary prevention. That is, people with chronic illness like heart disease and emphysema and asthma, and preventing them from getting sicker, needing the emergency room, having to go to specialists, being admitted to the hospital. Well, how do we focus prevention on these patients who have chronic illness? The first and most important thing is identifying them. Now, with a lot of data, we can do that much more easily. Most people go into their claims, that is, what healthcare services have people used over the last few years, provide some analytics, and then identify patients who are likely to be high cost in this year and the next year. Are these data analytic techniques for predicting high cost patients perfect? No. But they can reduce the number of people and really identify the group that is very likely to be high cost in the next couple of years. And then it's important, once you've identified them, to really change how you care for them. The first and most important change is it's not the doctor and the patient. It's now got to become a team that includes the primary care doctor, nurse practitioners, specialists, home health aides, dietitians, physical therapists, dentists, pharmacists, everyone who's going to deal with the patient so that they actually get care wrapped around them. Second, we need an electronic record so that whole team is on the same playing field, knows what medications the patient's on, what the strategy and plan is for their care, adheres to the best clinical guidelines developed by professional societies. An electronic health record is critical so everyone is dealing with the same information. Next, we have to actually provide 24/7 access to services so that if a patient gets sick at 11 o'clock at night, they can call up and someone who actually knows their care, has access to their electronic health record, can actually interact with them. We're going to, of course, as I mentioned, have to increase reliance on non-physician providers like the nurse practitioner, like the home health aide. There's going to be a lot more telephone and email interaction between patients and doctors. Going to get more information from the patient and interact with them and give them advice over the internet. Not every interaction with the patient now has to be face-to-face. And then I think a really important change is going to be an uptick in house calls and providing hospital quality services at home. Many, many years ago, when my dad practiced in the 1960s, he did a lot of house calls. And I remember his black bag. He had vaccines in there and sutures, and he would go to patients' houses. Sometime in the sort of 1970, that went away, and he referred his patients into the hospital. Go to the emergency room at night. Well, that's going to end because the emergency room is very expensive, long wait. Now we have a number of companies popping up that are doing web interaction with patients at night, where a patient can see a doctor or a nurse practitioner over the web, and the doctor or nurse practitioner can make a diagnosis. In the vast majority of those cases, about 75% of them from some companies, that can be resolved over the webcam. The others might have to go to the emergency room. Other companies send a nurse practitioner or doctor to the patient's house. Well, that costs about $400 or $500 to make a house call, but that can be a lot cheaper than a visit to the emergency room. The vast majority of these kind of interactions can be resolved without needing to send a patient to the emergency room. That will save a lot of money. Another way of saving money is if a patient gets sick enough that they actually need the hospital, is to treat them at home. There have been some recent studies at, for example, Presbyterian Health System in Albuquerque, New Mexico, where they take patients with an exacerbation of their emphysema, or a skin infection, or a urinary infection, or a pneumonia. And instead of admitting them to the hospital, they treat them at home. They give them their antibiotics or their breathing treatments at home. They send a nurse practitioner 1 or 2 times a day. They have the ability to do x-rays or ultrasounds at home. And it turns out that hospital at home care can be better than actually admitting the same patient to the hospital. It turns out adhering to quality standards goes up substantially at home. Rates of falls are less at home. The rates of readmission after treatment, the same whether a patient was in the hospital or at home. Mortality, the number of patients who end up dying, lower at home. Patient satisfaction is higher at home because, after all, who really wants to be in a hospital with the constant noise and interruptions? Being in a familiar home environment is much happier. And here's the real kicker. Patients who were cared for at home with these illnesses, they actually recovered faster. And totally, the cost of care was 19% lower. So this is another way that we're going to change care and save money and actually improve quality by taking more patients who we could admit to the hospital if they have a problem and actually treating them at home. And then, as I mentioned, that I think there's going to be a blossoming and flowering of telemedicine and digital medicine. Taking your blood pressure and through your smartphone sending it to your doctor. Diabetics taking their glucose measurement and hooking it up to their smartphone and sending it to their doctor. Continuous monitoring of heart rhythm. One of my favorites are these new glow caps, or these special caps on prescription drug pill bottles, because one of the biggest problems in healthcare leading to a lot of use of healthcare services is the fact that patients aren't always compliant with their medications. As a matter of fact, we know that when we give patients their medications, they take them right about 70% of the time. Well, these caps actually have a little LED in them that lights up when patients have actually taken their medication. And if by a set time, say 11 in the morning, they haven't taken their medication, a wireless note goes out to the doctor and to their family indicating they didn't take medication. And when the supply goes down and they need a refill, a wireless note goes out to the pharmacy. Turns out these kinds of pill caps, smart pill caps, actually get compliance up from around 70% to nearly 100%. And if non-compliance is a major reason patients end up in the hospital, well, these pill caps and digital medicine can help. Other groups have tried digital dermatology, taking pictures of rashes and sending it to a dermatologist with no interaction, getting care. Well, as I see it, over the next 5 to 10 years, there's going to be a real emphasis on treating these patients with chronic illness, making sure that they stay healthy. If they happen to get sick, caring for them more at home, using digital medicine to monitor them more frequently and intervene so that they don't get sick enough to go into the hospital. After a lot of savings have been realized by caring better for patients with chronic illness, I think there's going to be a shift to taking care of patients with psychiatric conditions much better.